Hi, good morning everyone. This is your neurologist Dr. Manish Mahajan from Gurgaon, and welcome on this very cool morning of 5th May 2022. So, continuing with the series on multiple sclerosis. So the discussion till now: what is multiple sclerosis, its types, its common symptoms, how we diagnose, and the three broad categories of treatment, that is the treatment of acute attack with usually IV methylprednisolone pulse, the second with the use of disease modifying therapies for the prevention of disability in multiple sclerosis, and the third is the symptomatic treatment. Now all these three broad categories we'll be discussing in the sequential episodes in detail. So today we'll discuss about the acute attack or acute exacerbation or relapse of multiple sclerosis. So as I defined acute attack of multiple sclerosis yesterday, so it all depends upon the severity. All attacks do not require steroids, first of all. Second, we can keep the duration of the infusion or like for 3 to 5 days, and the course of IMP-NPS can be given for 3 to 5 days. Many times what happens is that the attacks are quite severe. They don't respond to even IV methylprednisolone pulse, or they respond partially, especially for attacks which are very severe like visual loss or paraplegia, right, that is the weakness of both the legs. Then we usually resort to an infusion therapy, which is a slightly costlier one, that is IV immunoglobulin, IVIG therapy. This therapy basically is an immunomodulator which blocks the pathological antibody circulating, and at times it does help with the severe cases. Another modality which we call as plasma exchange can also be used, but most of the cases usually resolve to IV methylprednisolone pulse. Now the acute attack usually stays for 24 hours at least, and that is how it is defined. The symptoms usually resolve partially or completely. Now this is not the primary thing that we just want to treat that relapse. We also want to prevent the disability from these relapses. So we want to prevent the relapses from happening, and we also want to basically stop the progression of the disease independent of this relapse activity also. So in the subsequent episodes I will be talking about them. Goodbye for now. Have a nice day, and happy running in HDI challenge.